Thanks for supporting us. This is a new video with a new microphone. Today we're going to talk about the best emergency contraception. Ulipristal acetate, sold under the brand name Ella, among others, is a medication used for emergency contraception and uterine fibroids. As emergency contraception, it should be used within 120 hours of vaginally penetrating intercourse. Ulipristal is a progesterone receptor modulator that has been shown to be 99 to 100% effective at preventing pregnancy when given within 120 hours of intercourse. The high efficacy of Ulipristal compared with other regimens is likely due to its ability to inhibit implantation as well as ovulation. But please use this medicine exactly as directed by your doctor. This medicine is for occasional use as an emergency birth control. It should not replace your regular birth control method. You may use this medicine at any time during your monthly period, but do not use this medicine more than one time in the same monthly period. Check with your doctor immediately if any of the following side effects occur. First of all, we got cramps. We have heavy bleeding and pain. Call your doctor for medical advice about the side effects. And we have common side effects like headache, nausea, stomach pain, unusual tiredness, or weakness. You may take this medicine with or without food. If you vomit within 3 hours of taking this medicine, call your doctor right away. Your doctor may prescribe another tablet for you. Call your doctor right away if you have severe lower stomach pain 3 to 5 weeks after taking this medicine. There is a condition called ectopic pregnancy. You may have a pregnancy outside of uterus, and which is called an ectopic pregnancy. Do not use any additional emergency pill, for example, levonorgestrel, within 5 days after taking this medicine. This medicine will not protect you from getting HIV, AIDS, or other STDs. If this is a concern for you, talk with your doctor. Do not take other medicines unless they have been discussed with your doctor. This includes prescription or non-prescription medicines and herbal or vitamin supplements. Thanks for listening. As I said earlier, this is a new microphone. Keep supporting me. We're going to record better videos and share this video with your friends. Don't forget to watch our folate deficiency science video. See you on the next one.